Today we will discuss alcohol use disorder, but really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Alcohol use disorder, AUD, is a condition where a person has difficulty controlling their drinking appetite, despite negative consequences. In simpler terms, it means that someone drinks too much and struggles to cut back even if it harms their health, relationships, or their daily life. Signs you might have AUD: drinking more than intended. You often drink more alcohol than you planned. Failed attempts to cut back. You've tried to reduce your drinking but found it hard to do so. Time spent drinking. A lot of your time is spent getting alcohol, drinking, or recovering from drinking. Neglecting responsibilities. You miss work, school, or social activities because of drinking. Withdrawal symptoms. You feel sick or anxious when you don't drink. Continued use despite problems. You keep drinking even when it causes issues in your life, like arguments or health problems. What to do? If you think you might have AUD, consider talking to a healthcare professional. They can help assess your situation and give you options to support it, whether through counseling, support groups, or treatment programs. If someone has alcohol use disorder, here are some simple steps to take. Talk about it. Encourage them to talk about their drinking and how it affects their life. Seek help. Suggest they see a doctor or a counselor who understands AUD. Support groups. Recommend joining support groups like Alcoholics Anonymous AA, where they can connect with others. Set goals. Help them set small goals for cutting back or stopping drinking. Stay positive. Offer encouragement and be supportive throughout their journey. Avoid triggers. Help them stay away from places or situations that make them want to drink. Focus on healthy activities. Encourage engaging in hobbies or activities that don't involve alcohol. In the hospital, if someone with alcohol use disorder needs help, here's what usually happens. Assessment. Doctors check their health and symptoms to understand how severe the situation is. Detoxification. If they are dependent on alcohol, they may go through detox, where they stop drinking under medical supervision to manage withdrawal symptoms safely, because keep in mind, alcohol withdrawal can kill you. Medications. Doctors might give medications to reduce cravings or help with withdrawal symptoms. Counseling. They often receive counseling or therapy to talk about their drinking and learn coping skills. Hospitals may connect them with support groups or programs for ongoing help after they leave. Discharge planning. Before leaving, staff will help set up a follow-up care and support to continue their recovery. Here are some commonly used medications for alcohol use disorder. Disulfiram, brand name Antabuse, causes unpleasant reactions if alcohol is consumed, which can deter drinking. And by that, this means that if you take this medication called disulfiram and then you consume alcohol, you'll most likely get extremely nauseous and you will not feel very well. The second medication is naltrexone, brand name Vivitrol or Revia. This reduces cravings for alcohol and helps prevent relapse. Third medication is acamprosate, brand name Camprol. This helps stabilize brain chemistry after quitting alcohol, reducing the desire to drink. And the third one is topiramate, brand name Topamax. Sometimes used off-label, it can help reduce alcohol cravings. These meds are usually prescribed as part of a comprehensive treatment plan that includes counseling and support. Certain people are more likely to develop alcohol use disorders. Here are some factors that increase the risk. Family history. If someone in your family has struggled with alcohol, you might be at a higher risk. Mental health issues. People with anxiety, depression, or other mental health problems may turn to alcohol to cope. Young age. Starting to drink at a young age can increase the chances of developing problems later. Social environment. Being around friends or family who drink heavily can encourage similar behavior. Stressful life events. Experiencing trauma, loss, or high stress can lead to increased drinking. Lack of support. Not having strong social connections or support can contribute to alcohol problems. Now you need to watch my video on alcohol withdrawal or have a look at benzodiazepine withdrawal.